As the year comes to an end, we want to take a moment to reflect on the incredible journey and celebrate HEPU's milestones. From think tanks to workshops and trainings, developing frameworks and conducting various research studies, to showcasing our successes at local and international conferences, all of which was made possible through the hard work and unwavering dedication of the HEPU staff. Think tanks are a core of HEPU's vision, serving as a hub for innovation and collaboration to solve complex problems. This year, we highlighted the success of 3 think tanks, each playing a pivotal role in achieving our goal of thinking together.
2024, we had very exciting 3 think tank meetings. The first think tank meeting actually was based on the philosophy of thinking together in evidence generation. And the first one was the think tank, which was focusing on charm, value for money. This is a research looking at the value for money for charm in order to inform government in the new agreement. The second one was direct facility funding to look at its efficiency and its governance structure. And the third one was an international think tank which attracted experts from Europe, from our partners in Europe, UCL, Imperial, York, etc. And it was focusing on one institutionalization of the famous TANS model, which was generated in Malawi with our partners, and the second scaling it up to the extra region. And also we looked at the emerging issues like HTA, effort technology assessment. We also looked at DFF, direct facility funding, but also a VEDMAP, which is about value and evidence-based decision making and practice. We also zero in the issue of charm, value for money. So in short, it was in summary, it was a very exciting year, full of discussion, but also wonderful interaction between policymakers and researchers in optimizing on the best available evidence for optimal decision making.
HEPU has a great team working on the ground on various projects. For instance, the Deputy Director, Dr. Dominic Mkoma, was instrumental in the success of the Direct Facility Funding Workstream.
Yeah, so in the 2024 year, there's been a lot of work on the DFF. So we completed the RUMPI pilot evaluation and presented results to the think tank, and these results were well accepted by government and partners. We also conducted collection of baseline data ahead of the full scale-up of the DFF by government to then facilitate a baseline, midterm and final evaluation of the DFF, so we could see to what extent the DFF is impacting on service delivery. Another major piece of work we initiated was exploring community governance configuration. As you know, our major research area is the extent to which community governance can squeeze efficiency out of providers. So this work stream was initiated also inside the year, particularly focusing on examination of the board arrangements in CHAM and drawing lessons from there. For the baseline, midterm and final evaluation, this requires defining the M&D framework. We've been supporting government, so we've finalized this, hoping to get it adopted early next year. But also, there's been already heavy investment in the TANS model, as you would have known from other work streams. So we've initiated work to bring the DFF on the transit and then allow more robust impact evaluation in the future.
Members of the team had the privilege this year to share our research findings on international platforms. One of the most notable travels was that of Dr. Lakingwira, who showed the strides made in achieving evidence-based decision-making through the use of health technology assessment, HTA, in Malawi.
There's been a lot of successes in HTA. The conceptual framework was developed and this has been approved for immediate implementation by the Minister of Health Senior Management Team. And in the meantime, we are now developing the SOPs to guide the HTA mandate for Malawi. And so soon we'll be engaging parliamentarians because we want this one to go into kind of the Public Health Act in Malawi. So it's really something of its kind, first of its kind in Malawi to assist in the resource prioritization in Malawi. So there's been, 3 travels that I can single out. So number one was in Kenya, where we showcased the HTA framework that we developed in Malawi. So this was at an emerging technologies meeting in Africa. So different regional economic committees were brought into this meeting, and we were given a platform to showcase an HTA framework that respective countries can also take on board for their countries to assist in the identifying emerging technologies and which one should be kind of implemented by different countries. So to us, that was really putting us on the map in terms of what we've done and what other countries can also do or learn from what we've done.
Locally, Mr. Sebastian Moma ensured the effective dissemination of research from the Health Sector Joint Fund evaluation at the 3rd KUHeS Research Dissemination Conference.
It's indeed that time of the year when we need to recap what HEPU has been engaged in over the year. Particularly interesting is how we managed to showcase some of the works that we've been doing at the Research Dissemination Conference this year. So I was actually engaged in the health sector joint fund evaluation, and this is a joint fund by the British government, Norwegian government, and the German government that came in collaboration with the Ministry of Health to fund interventions under the Ministry of Health after donors had pulled out from directly supporting the budget. So the evaluation actually was looking at the fund's performance since its inception in 2017, and it covered up to 2022. In terms of performance, we look at the fund as that has performed very well, much as 50% of the funds that were earmarked for the projects had not been utilized. The biggest culprit had been logistical problems and bureaucratic barriers, but this has been also fed back to the fund, and with the hope that it's going to be rectified. Another culprit was that there was no strategy that was put in place for sustainability, and this has been reported as well. So all in all, we are saying that HEPU is actually doing very well, and these works have been showcased by different colleagues at the RDC, and beyond that, there are reports that have also been written on the same project.
Additionally, Ms. Chifundo Kunyenje has been vital in assisting the Ministry of Health in the development of the Health Financing Framework, Monitoring and Evaluation Strategy, and Dr. Joe Zwanda on the assessment of the value for money for contracting charm service providers under the Service Levels Agreements.
I'm Chifundo Amensia Kunyenje. I work here as a health economics research fellow and have experience in health financing as well as monitoring and evaluation. Given this expertise that I have in health financing as well as M&A, I've been a key figure for the Ministry of Health this year, 2024, in helping them in designing the health financing strategy M&A framework. So the main task for this work was supposed to have a baseline study for the health financing in Malawi. But seeing that there was a gap that we couldn't just jump into conducting the baseline study, we needed to have like a comprehensive framework for the M&D, for the ministry. So that's the work that we started with. We've been designing the M&D framework for the HEPU financing strategy so that we can actually establish what are the key indicators that we'll be using to collect HEPU financing work in Malawi, but also for the Ministry of Health. So we've done that in collaboration with various stakeholders. We have USAID, we have WHO, we have World Bank have helped us in terms of funding. Above everyone else, we have the Health Services Joint Fund, who are our main funders. They've been at the backbone of this work. But also apart from these funders that we've been working with, we've also had the Ministry of Health stakeholders. Those are the policymakers, both from CMED, that's Central and Monitoring Evaluation Department, but also we have the HEPU Financing Division. So we've been working hand in hand together with them, various consultations, various literature review for us to come up with that framework. So that has been developed. It has been reviewed by various stakeholders, both at national level, but also we invited some other stakeholders from the districts for us to actually review whether the indicators that we've developed are relevant at both levels based on the requirement.
So one of the key projects that I've been working on is the assessment of the value for money for contracting charm service providers and under SLAs or service level agreements. So just to give you a brief background, since 2004, the government has contracted charm service providers to provide a predetermined set of services included in the EHP free of charge to rural communities, and in turn the government pays or reimburses charm facilities for the services they have rendered, and this is all done under service level agreements. And the agreements are basically guided by the memorandum of understanding between charm and the government. The government is represented in this case by the Ministry of Health. So the MOU expired in 2016, so the government or Ministry of Health required evidence in order for them to undertake negotiations for renewing the MOU. So they now commissioned this study to look at or to assess the value for money for the SLAs as well as their efficiency. So this assessment was pioneered or was led by Health Economics and Policy Unit in collaboration with our partners in Chad.
Additional travels from Mfutso-Bengo, whose travels to the UK and Thailand exposed him to how disease modeling is applied in other countries and enhanced his skills in developing disease models.
My name is Mfutso-Bengo. I'm a programming research fellow working under the TANSI project at the Health Economics and Policy Unit. So I'll give two highlights mostly. So I'll start with the short course at Imperial College London. It's quite an experience, I must say. It takes you from the fundamentals of math, and then you go on to the fundamentals of disease modeling, and then it starts going deeper, right? They start adding more components and parameters until you reach a point where they try to make you to be able to critique research papers from other modelers, and that is also beefed up by giving you more like a capstone project as other schools do, right? So it really prepares you to be able to critique other papers and also do in-depth disease modeling work. So I mean, the learning doesn't end in class. After that, you also have to interact with other people and you learn more from their experiences and their projects that they're working on. Yeah, but besides that, I think the other highlight came from the infectious disease modeling conference in Thailand. Over there, I was presenting on multifaceted disease interactions and interventions. So it was quite an experience for me, and I would say that it helps you to learn more because there's also like a conference workshop before the conference. So you sort of like learn the disease modeling aspect from it, and then after that I was able to meet different what are known as research software developers. So when you're working really back home here, you think maybe you work in an island, but they actually have a professional society. So I took the opportunity to join that society too, and at the same time I was able to also find maybe more funding opportunities that HEPU could explore.
My name is Precious James Titsulo, and I am a data scientist. Yeah, so I will take you through this exciting journey that I've been on this year, working on the Tanzilama project, where we were conducting the Tanzilama study. This study aimed at enhancing understanding of the healthcare delivery processes here in Malawi, but also resource allocation across various facilities. So it does this by, the study aimed to do this by collecting real-world data from 29 facilities that were sampled across the country. And the composition of these facilities included all the levels of care, where we have 5 tertiary hospitals, we had district hospitals there, community hospitals, as well as health centers. Yeah, so why we collected this data, when we collected this data, was to inform the Tanzilama model, the TLO model, which is the first ever comprehensive whole system, all disease kind of a model. That like for the first time, I mean, it's been implemented here in Malawi, and we're trying to collect data to try to complement or supplement the data that is already in there from various studies. We just wanted data that is more granular in terms of detail. Yeah, so right now the study is at a stage where we are about to start analyzing the data to inform various papers that will be drafted from it, policy briefs and other things. The first paper that has come out of this study is a profile paper, which is like a data paper that is talking about an overview of the data sets that were in the two. So this paper has actually been submitted to a publisher, Welcome Open Research, and the preprint is online right now. Yeah, so it's been quite an exciting journey. Looking forward to the other papers that will be coming. We cleaned the data, we anonymized it. Some analysis has started, but the major work that has happened, I think, on the data is the cleaning. And then papers will be drafted. I think HEPU will lead 3 of the papers. One of them is the one I talked about already, which is online, and then there are 2 more papers that HEPU will lead. The other papers will be led by colleagues from University of York, Imperial College of London, and others. Yeah, so I think in a nutshell, that's how this year has been.
This year, HEPU hosted a series of workshops which served as a platform for capacity building and hands-on training sessions.
My name is Mrs. Juma Bunyenga. I'm the Senior Scientific Administrator for the Health Economics and Policy Unit. 2024 has been a very great year for HEPU. We've had so many successes. We started on a very high note. We had a workshop in Tanzilama, our data collection, where data collectors were oriented on how to collect data in the fields. We also had a couple of workshops on health technology assessment, where several stakeholders had to come together to develop a health technology assessment framework for the Malawi health sector. Apart from that, we also had other workshops on health financing baseline. Since Malawi has recently adopted a new strategy in health financing, and the Health Economics and Policy Unit is supporting and evaluating the baseline. Finally, we had a workshop on disease modeling, which brought together policymakers, stakeholders, academics to build their capacity in disease modeling. Overall, it has been a great year for the HEPU. and we look forward to 2025.
My name is Precious Chibe. I'm a Health Economic Associate Research Fellow. So I'm going to talk about the trainings and the workshops that we have had this year. But I'm only going to talk about two that stood out for me. So I'm going to talk about one workshop and one training. So for the workshops, what stood out for me was the International Think Tank Conference. For me, it was exciting because it was a good platform for networking with our international collaborators. We are also able to learn about their research methods, and also able to recommend to us on what we can improve on our research. Yeah, so for the International Disease Modeling Training, I went there as a participant. It was organized by the Tanzania international team. So it was exciting for me because it was my first time to learn about modeling, and they made it so easy for me to understand. And through that, I learned how to predict the spreading of diseases, as well as predict the outcomes of disease interventions, which later on do have an impact on decision making. So I can confidently now engage in conversations about disease modeling, and I can make policy recommendations because of that training.
Saying goodbye is never easy, especially when it comes to valued team members who have played an integral role in HEPU's success. This year, we said goodbye to Emmanuel and Michaela, whose contributions were invaluable to the 2024 successes. While we are saddened by their departure, we are excited to see what opportunities await them in the next chapter of their lives, and we are confident that we've equipped them with a strong foundation to excel. We are very proud to have been a part of their journey and wish them all the best.
I arrived this time last year, and what a ride it's been. I've gotten to see so much of the country, go on so many adventures, and I get to call HEPU family. They've taken such amazing care of me. They've been so supportive, and I've never met a more caring, smart, and the very definition of public service in the absolute best way. And I'm so lucky I got to be a part of that this last year. So a round of applause. And I can't say too much more, or else I will cry, but it's not a goodbye, it's a tioanana.
Dear colleagues and friends at HEPU, I bid you farewell as I embark on a new chapter in my journey joining EXA. I should say I'm grateful for the opportunities I have had here at HEPU, and I appreciate the support and the collaboration we have shared during, I should say, my 4 years at HEPU. I'll always cherish the memories and the experience we have created together. I'm excited about the new challenge and opportunities that awaits me at EXA, but at the same time, I'll miss the HEPU community. I wish you all continued success and growth, and I hope our paths will cross again in the future. And thank you for being an important part of my professional journey, and I wish you all the best. Farewell. Thank you.
Although goodbyes are never easy, we're thrilled to bring on board Celia and Mariana, who have brought in fresh energy, new ideas, and have already made an incredible impact in the few months they've been here.
I've had very good experience so far with HEPU. I was able to go to Desanje for a trainer of trainers workshop where people from Ministry of Finance, Ministry of Health, Ministry of Local Government, and so on. They did a training of the district people at the district level to go out to health facilities to work with health facilities and community members. It was very interesting, and I enjoyed the interaction of the people involved who had real world questions about, well, what am I supposed to do when this happens? So that was nice. And I also had the opportunity to go to a research dissemination conference in Blantyre, and that was, the level of science there I was very, very impressed. It was nice. Much better than some conferences I've been to in the United States.
Yes, so my name is Mariana Suarez. I'm an epidemiology modeler. I've been at HEPU for 3 months. I'm here with the Peace Corps organization from the US. And my time at HEPU has been amazing. I think 2 things that I would love to call out are 1, the people, and 2, the work that we're doing. So 1, in terms of the people, everybody has been extremely welcoming and sharing of their experiences, looping me into their different projects, so I really get a comprehensive view of what's going on in the world of health in Malawi, and that's been fundamental for any of the projects that I work with. And then the second, in terms of the work that HEPU does, I think that HEPU is in such a beautiful position of intersection between policy, research, and like on the ground realities. So I really see the team pushing for making sure that anything that is being discussed in research actually gets applied on the ground to make a difference for Malawians day to day. And I think it's been great to work with the team who cares about making research into reality.
Moving into 2025, we will continue with some of the work streams that we initiated. So, for example, exploration of community governance configuration. I think we're hoping to get this work concluded the first phase, and then we'll move into implementation of the M&D framework, working with digital health financing technology working group, or monitoring and evaluation division in the MOH, to set up the systems that would then facilitate ongoing evaluation by HEPU. Yeah, we will also expand our efforts to model the DFF or potential impacts on the TANSI, thereby ensuring that in the future we're able to produce more reliable estimates on how the DFF is, or to what extent the DFF is improving service delivery and achieving its objectives. More broadly, we work with government. So yeah, we will continue also our work in the steering committee, supporting the implementation of the DFF, while of course focusing on our role as evaluators. Yeah, that's it from the DFF work stream.
2025, it's a very exciting year, and the number 25 is a beautiful number. So we think that in the coming year, we're expecting further growth of HEPU, Health Economics and Policy Unit, as an organization. We are expecting to receive new staff members, but we're also looking forward to come up with new proposals, to write research grants, to continue in the think tank process of thinking together in an interaction with policymakers in order to generate the best available evidence for optimal decision making. We are also looking at harnessing and enhancing our international collaborative partnership with our collaborators. We think that our motto is thinking global and acting optimally locally, and therefore we think that we'll continue with partnering with our partners both locally and internationally. We are also thinking of innovating, coming with new ideas. We are developing an idea bank where ideas, regardless from whom it comes, just to keep it and develop it further. Once again, I see 2025 be a milestone, a bigger milestone for HEPU, that HEPU will continue to grow into great heights.
Thank you to all our partners, funders, and everyone who participated in our workshop, conferences, and trainings. We look forward to further collaborations for greater achievements and new opportunities to make 2025 an even better year.